Good afternoon, all. For those who don't know me, my name is Arya Ramachandran. Today I have the pleasure of re-interviewing Dr. Kshitij Mistry. Dr. Mistry is a pediatric critical care physician who works in the Department of Cardiology at Boston Children's Hospital. Dr. Mistry has also had some experience treating kids with the new arising disease during this pandemic, multisystem inflammatory syndrome in children, or MISC for short. With that in mind, I'd just like to thank you, Dr. Mistry, for being here and dive right into the questions.
Thank you for having me back, Arya.
Of course. Now, okay, so could you just explain to us what multisystem inflammatory syndrome really is, just in a nutshell?
Sure. So multisystem inflammatory syndrome in children, or MISC, as you've described earlier, is a general term for what we feel is an inflammatory state of the body after having been exposed, we believe, to coronavirus or COVID-19.
Right.
And what that involves is essentially a exaggerated response of the child's immune system, which then leads to multisystem organ dysfunction.
Cool. Okay, so also what is Kawasaki disease, is I believe how it's pronounced?
Yes, a lot of experts in the field, including those at Boston Children's Hospital, have drawn a similarity between MISC and Kawasaki disease, in part because some of the presenting symptoms are similar. Kawasaki disease is thought to be, again, a increased inflammatory state, perhaps related to an exaggerated immune system response, oftentimes after a viral infection, which the symptoms include fever, rash, some enlargement of lymph nodes, and then swelling of the hands and feet. And some of the initial symptoms I described, the fever, the rash, are things that are seen with this MISC condition as well.
Right. But just to clarify, these are two different diseases, but are you suggesting that they're linked to each other, or in a sense relatives to each other? Like, could you just clarify that?
Sure. It's not that the Kawasaki disease and the MISC are the same. It is that they may have a similar type of triggering to lead to the condition, which what I mean is there may be a virus that then triggers an exaggerated response to the immune system and then leading to similar symptoms. It's not necessarily true, or we don't know that to be true, that children who have an increased risk of Kawasaki disease now have an increased risk of MISC.
Right. Okay, so how prevalent do you believe this specifically, or both diseases, how prevalent do you believe that they are? Because as of last Thursday, there were around 250 cases, I believe, in the US, and over 150 of them were contributed by New York. So do you believe that Boston can be relatively shielded due to how we are preventing the spread of the coronavirus if we just take the same precautionary measures, or just how, in general, how do you think this disease is going to go as far as coronavirus? How prevalent is it?
Sure. The incidence of illness related to coronavirus in children still remains very low. So just as we've talked about in our previous discussion, that the numbers are exceedingly low with regards to children who are affected by coronavirus, either by the respiratory failure, which is the symptoms many of the adults had succumbed to, but even including with regards to MISC. The number of children who have been exposed or have coronavirus or COVID-19 positive test results and then develop this is still very low. With regards to New York, as you mentioned as well, part of that may be related to that there's an increased rate of coronavirus being recognized there, or COVID-19 related conditions, and therefore their numbers may be, absolute numbers may be more than, for example, Boston, but the percentages are still low when it comes to the total population that's been ill with coronavirus.
Right. Okay, so I know you have briefly mentioned the symptoms before, but are there any more specific symptoms that doctors will look for when trying to see whether this person has COVID, MISC, or Kawasaki's disease?
It's a good question. So the symptoms that we see these children presenting with MISC include the fever, as I described before. There's often a rash, which has taken many forms. And then also GI symptoms. So by that, I mean diarrhea and vomiting. We've certainly seen that in the children that we've taken care of at Boston Children's Hospital as well. Those are three of the common symptoms that we have seen. The other thing that's worth noting is that since this condition is thought to be related to the immune response, it may not coincide directly or related in time to when the child is first exposed or becomes positive for coronavirus or COVID-19. So there's a separation in time between, for example, when they may be exposed to the virus, become positive for the virus, and then developing these symptoms later on, which can be up to several weeks.
Okay. Okay, so I know this is, we're looking at specifically children, but in this a child's age group, maybe up to teenagers or 21, how are different ages susceptible to it?
It's a good question. And this goes back in part also to your question about Kawasaki's disease. What we've seen, for example, in Kawasaki's disease, that the age group is predominantly those that are 5 years old or less. At least some of the initial reports out of Europe, which is where we have the most numbers for experience, since they obviously have had a higher incidence thus far of coronavirus and COVID-19 or more time to observe this clinical condition, is that it's often an older age group. I believe the recent studies have suggested a median age of around 10. And so a little bit older than what you would see, for example, with Kawasaki's disease, but although there is some overlap, there are some younger and some older. The other thing that's worth noting is that these children, at least that have been described thus far, and there's not a large number of them, so we're going on smaller sample size, is that many of them don't have a specific medical condition that puts them at risk that we have identified. So what we've seen is that these are what are thought to be previously healthy children who then develop this MIS-C condition. Okay.
So actually that was my next question, where I was going to ask whether if kids with pre-existing conditions would have a lower or higher chance of getting the disease. But has there been any sign of this, or is it just so few that it's impossible to really make a statement?
I think your latter point is probably where we are at the moment, is that we're still gaining points on the curve.
Right.
And although we've started to describe this over the last several weeks in the US and for a longer time in Europe and in Asia, the numbers are still small enough where they were still waiting to get enough of a size of sample that we can make these conclusions. At the moment, it is hard to say.
Right. So are there certain ethnicities that are more prone to the disease than others?
For the MIS-C condition?
For the MIS-C condition, yes.
Although there has been, for example, some initial reports reporting them in Asian children or those of Afro-Caribbean descent, that may be in part related to just being exposed or having a longer time to observe those populations, as opposed to having some genetic predisposition. Just like Kawasaki's disease, we're not sure at this point why some children who expose the same virus develop an exaggerated immune response and others do not.
Right. So what are the current treatments that the children with this disease have to undergo in order to, cure themselves of the disease?
Mm-hmm. Just like we talked about earlier with the adults with coronavirus and the children had developed respiratory failure, much of the treatment at the moment is one, supportive, in that if a child requires medication to help the heart squeeze at a more normal strength or requires medication to help the blood pressure remain in a normal range, then those are the supportive measures undertaken. But also the other aspects of the treatment here is that since it is a high inflammatory state, perhaps an exaggerated immune system response, some of the therapies are aimed towards that. So for example, steroids have been utilized, which may reduce the immune system response and may decrease the inflammation. Immune globulin is also a medication that may be used to attenuate some of the inflammatory symptoms that we see with these children. So both supportive as well as anti-inflammatory or immune system reducing medications.
Okay. So, can parents take any precautions to prevent their children? Obviously, we have quarantine where it's just staying 6 feet away, socially distancing. But is there any specific special precautions that need to be taken for this disease?
Sorry, Arya, there was a truck that rolled by just a second ago. And so what I thought your question was that are there any special precautions we could take in the context of MIS-C? Is that correct?
Yes, that's correct.
Good. Right. It's a great question. And so I think the strategies are still the same, which are great hand washing, social distancing, and wearing masks, certainly when social distancing is not feasible or when in areas where other people may be around. Those are the things that we have used to prevent the spread of coronavirus and COVID-19 associated conditions are the same that we would use for this.
Okay. So, how concerned should people, parents, anyone really be about this disease in the light and like with these cases coming forefront?
That's a great question. And certainly, as I mentioned before, the numbers of children who are affected not only by coronavirus that requires hospitalization, and then secondarily, those that actually then go on to develop MIS-C symptoms is still very low. And so I think, again, the strategies with regards to I described before, good hand hygiene, social distancing, wearing a mask, are things that still are what I would suggest people use to prevent any sort of spread of coronavirus.
All right.
And
So,
one thing I should also add on to that, Aria, sorry, is
okay.
that as far as the reassuring aspect of this is that the children that we have at least observed that with this MIC condition all have very favorable outcomes and close to full recovery. And so again, even while having this condition, the recovery is still very favorable.
Right. So, do you have any parting thoughts that you'd like to add before?
I think we're at a unique time now because, as you know, many of the states, and Massachusetts included, is now contemplating opening up some businesses in various phases, for example, in Massachusetts. And so I would then just emphasize again is that using the same sort of cautionary strategies with regards to as we open up the economy and open up businesses and we're exposed to each other, that just remembering that the strategies that were used to help flatten this curve and keep the numbers under control are ones that we should still continue to employ.
Okay. And so sorry, but this question just popped into my head. Do you think that the government or just towns or states should be more wary about opening schools now that this MIS-C is more prevalent, and obviously it's just more of a nuisance to add on to this COVID-19 situation?
I mean, I think that this certainly enters into the formula of the calculus with regards to whether we should open or how soon and how to open these schools. Certainly that's the case. That before we had seen that most often children were very relatively unaffected by this. And now that we see that there is a condition that is affecting children, that may be something that we should take into consideration.
Understood. Well, thank you so much for being here and taking the interview. I really appreciate it, and I'm glad I was able to learn more about this disease because it's really new, and I think people should understand what they're stepping into.
Thank you again. I'm happy to be here.
Yep.